We'll note that there is a substitute to consider on next meeting in relation to the policy of technical addition of one word to French. So with that, I think everyone has it. Actually, I'm sorry, they did it as the next one. I thought they were going to substitute certain words in the application.
Thank you, Madam Chair. Appreciate the opportunity to share with our committee today. House Bill 491 is introduced and creates the Healthcare Rights of Conscience Act, and it would allow a healthcare provider to refuse in advance to provide healthcare services that conflict with the provider's moral, religious, and ethical principles by objecting in writing to provide the health services. The bill provides that in a life-threatening situation, a healthcare provider who objects to providing services that conflict with their moral, religious, ethical principles shall provide services until an alternate healthcare provider capable of providing or participating in the emergency treatment, care, or procedures available. It does not apply to abortion clinics. The bill further would provide an opportunity for a lack of conflict in relation to provision of services, having those services which a person chooses to have to be provided by those who want to provide those services and are a part of the view that they have. And in this situation, I would feel very strongly that this provides an opportunity for us to avoid conflicts and issues that we would have had prior to this. Thank you.
We will now move into the public hearing portion of House Bill 491. We have 5 proponents, 2 opponents. So let's hear from Leonard Adams first.
Esteemed members of the board, if you were to Google "Why was America founded?", you will find that the top entry comes from the Library of Congress. The first sentence of that entry declares that many of the British North American colonies that eventually formed the United States of America were settled in the 17th century by men and women who, in the face of European persecution, refused to compromise, passionately held religious convictions, and fled Europe. America was founded because people intuitively understood and defended their inherent right to live according to the dictates of their conscience. Indeed, it is the reason America came to be. In 1948, the issue of the right to conscience was dealt with by the United Nations General Assembly in Article 18 of the Universal Declaration of Human Rights. It reads, "Everyone has the right to freedom of thought, conscience, and religion. This right includes freedom to change his religious belief, and freedom, either alone or in community with others, and in public or private, to manifest his religion or belief in teaching, practice, worship, and observance." In 1974, the Assistant Secretary General of the United Nations, Sean McBride, said in his Nobel lecture, "To the rights enshrined in the Universal Declaration of Human Rights are one more right with relevance needs to be added. It is the right to refuse to kill." House Bill 491 recognizes healthcare workers as human beings and Americans, not automatons or healthcare snack machines. Planned Parenthood's Southeast Vice President Nikema Williams released a statement against the bill saying it seeks to deny women's health care for political reasons. "When discrimination is legal, women pay the price," she said. This seems an odd statement to me, a black man. Nevertheless, a law that protects healthcare professionals from violating their consciences does not deny women health care any more than the fact that I cannot buy lasagna at McDonald's denies me the ability to eat lasagna. I just need to go find a restaurant that serves lasagna. Thank you.
Cheryl Ciamera.
Alabama Citizens for Life is pleased to support this legislation. It has been several decades in the working, getting the language specific enough, and I think because these things applies to cloning, embryonic stem cell, abortion, specific life-ending and terminating procedures, people should have a superseded right to their conscience, and we are grateful to Representative Mooney for bringing this legislation forward. Thank you.
Joanne Cummings.
hello again. I object to HB 491, the Healthcare Right to Refuse Medical Services Bill. Healthcare providers have a sacred duty to ensure that their patients receive complete and accurate information so that they can choose the appropriate medical treatment based on informed consent. This act would affect the ability of women to be fully informed of all medical options because her physician may refuse to include all of them due to his personal beliefs. This bill extends the right to refuse to provide services to every staff member in the food chain of medical care. There is no way a patient can know that all options were considered and offered, not just the ones the workers approved of, because no one but the employer knows who objects to what. Maybe they need little pro-life badges. If this bill passes, there is no way that any woman of childbearing age can trust the medical staff at any hospital or medical service provider to place her needs first. It is obvious with all of your sponsors that this bill will pass, but I ask you to consider adding a public notice amendment to this bill. This amendment would require that any facility where these objectionable services might be performed have a large public notice placed of each business interest and on the facility website. This notice would state, because of Act 2015 whatever, there may be certain medical services you need which may not be available at this facility due to religious conscientious objection. People entering a business have the right to know that all of the options of medical care may not be available to them. These signs would provide fair warning that their needs may be denied and their choices not even mentioned, so that they can go elsewhere and not waste their time and money. The consumer has a right to know. I can even see an iPhone app in the future that ranks hospitals and medical service providers according to their religiosity score or their medical objectiveness on a scale of 1 to 5. Please stop this continued assault on the war on women's reproductive rights.
Johnny Brooklier.
Thank you, Chairman Weaver and committee, for allowing me to speak to you today. My name is Johnny Brooklier. I own 2 pharmacies, one in Adamsville and one in Alabaster. I'm a member of numerous community and church and professional organizations, but today I represent myself and like-minded healthcare professionals. It's wonderful that we live in a country where we can speak freely about our faith. It's wonderful that we live in a country where we can worship what we believe. It's wonderful that we live in a country where we can share our faith. It's wonderful that we live in a country where we can practice our faith. Or can we? In some states, pharmacists are forced to perform tasks that are contrary to their belief. In California, pharmacists are required to fill prescriptions for abortions and assist in the murder of innocent children, even if our faith says otherwise. Some healthcare professionals will do what is required, either by law or by their employer. It will be impossible for me to go against my belief. For some, it will be a matter of faith or their job. In Alabama, we should stand up for religious freedom, protect the rights of all believers, of all faiths. House Bill 491, the Right of Conscience Bill, gives me the right to stand by my faith and my beliefs. It gives me the right to protect the life of children and gives me the right to practice my faith. It would also be wonderful if we could live our faith and practice our faith, not just in church, but in our everyday life and in our professional life. As a pro-life believer, I should not be forced to assist in murder or any other procedure that is contrary to my faith, regardless of the legality of the action. When House Bill 491 passes, it will be even more wonderful to live in a state that recognizes religious freedom. Thank you very much.
Thank you. Amy Beth Shaver.
Representative Mooney, thank you very much. I wanted to speak on behalf of my husband and father, both of whom are physicians. They could not be here with us today, but my husband sensed this. He said that his name is Dr. Christopher Shaver. He practices at Brookwood Medical Center. And while he was going through medical school, and my father as well, had the opportunity to perform abortions or learn about performing abortions, and both said this. We should be protected, as our first obligation is to do no harm. Therefore, a physician should never be compelled to violate their moral code with reference to abortion. And in addition to that, both my father and my husband has said before in the past that they would rather not practice medicine than to be forced to violate their conscience and their faith. Where does it stop if a doctor is forced to violate their oath? Thank you.
Rosalind McDermott.
I second Joanne Cummings' remarks, and as far as the ratings system, I think you may see that popping up anytime and in the near future, and thank you.
Eric Johnson.
Again, I'm Eric Johnston, Alabama Pro-Life Coalition. As Ms. Ciamara said, we've been working on this bill for quite a long time. I think it was first introduced in 1994. It's had several sponsors, and through those years, it's been worked on by just about every interest in the state. And the language now is agreed upon by everyone, including the Medical Association and the Hospital Association. You've heard what the people said here today. This is about conscience. We all have a conscience. There's old Polish proverb that conscience is the voice of the soul. It speaks to you. You know, if you do something to violate your conscience, you can't find peace. We don't want to put healthcare providers, and this covers doctors, pharmacists, nurses, all kinds of healthcare providers, in the position of having to do a procedure for one of these four things: abortion, embryonic stem cell research, human cloning, or sterilization. These are all Frankensteinian kinds of things. Like Dr. Frankenstein, he didn't mind doing what he did, but there are those of us who do mind doing certain things. This bill just protects those people, and so it is solely for the purpose of not violating their conscience. It has built-in safeguards for the healthcare providers, for patients. Emergency situations are covered. As I said, the Medical Association signed off on it, and everyone is good with it. Thank you.
Representative Moody, do you have any closing comments? Representative Hall has a question.
Each one of the individuals who've spoken in support of your bill used the issue of abortion. Did I not hear your statement indicated it was not an abortion bill? Am I wrong?
It does not affect abortion clinics in any manner. Any procedure that a person is able to receive, they can receive. It does, and at the same time, it does not affect abortion clinics. It only relates to providers of health care.
And there was another comment that was made that seems to make sense to me, and I think I would consider looking at an amendment that would do that, is that allows that particular provider that there be a statement just like we have presently in all of our buildings where they do not allow guns, that statement is clear so individuals realize going into that particular facility that they would be very much aware that they may be refused service. I will look at drafting an amendment to do that. I don't see that taking anything away from the proposed bill as presented, but it also provides an opportunity for those individuals to be aware that does exist. Thank you.
You're certainly welcome to do that, ma'am. The process would, at that point, probably violate the rights of other people in the facilities who did not share the same religious conviction. They might not have a concern about that, so it might not be blanket in that sense.
Well, I think we can have that discussion, and I believe in light of what we're saying we're trying to do and how it impacts individuals, that I understand the process, so we'll deal with it as we go. Thank you.
Any other questions for Representative Moody? That concludes our public hearing for House Bill 491.